Neil, again, that was a great presentation. Your thoughts about having a scribe. A lot of doctors right now are doing telemedicine because of the COVID situation from home. How do they get a scribe at home? I sort of had the same sort of challenge when we went to EMR. I was spending more time looking at the computer screen than the patient, and you sort of got used to it. But a lot of very successful practices had a scribe come in the room, but that wasn't covered by insurance.
Okay.
So your thoughts about that?
Yeah, the answer to that is, one, you don't have to have a scribe, but I think a scribe is very helpful. And most practices having staff members work remotely, and they can have a conference call, three-way between the doctor, the patient, and the scribe, who is at a distance from the doctor, and he or she has a computer and should be typing in all the responses to the communication between the doctor and the patient. And that scribe can now do the coding, provide the documentation. And also, what I wanted to mention during the program that I deleted is that when you're going to do time, you have to say 5 minutes were spent before the virtual visit to reviewing the patient's chart and lab results, and 10 minutes were spent after the virtual visit for me to create the prescriptions, schedule the next appointment, and provide educational material that was sent to the patient. And that has to be entered into the virtual visit that will account for time. So if you spent 10 minutes with the patient on the phone and 15 communicating before and after the visit, you have 25 minutes that gives you a level 3. Now, obviously, you can't spend 20 minutes to review a PSA result. I mean, that would be ridiculous, and obviously that would not be the case. But it's not unreasonable to spend 5 minutes in preparation for the virtual visit, and it's not unreasonable to spend 5 to 10 minutes afterwards. And the scribe adds all 3 of those components and puts that in the record, and now you can get to a level 3. You can't get to level 4 and 5 without a physical exam. So there's no way that if you spend 2 hours with the patient, you're not going to get to a level 5 on a virtual exam. So please know that you have to document that time before, during, and after in the record, and this can be done by the scribe who's working at home as well.
So let me ask you another question. There are a lot of seniors that are challenged with use of computers and iPads, and I sometimes feel that way myself and get frustrated. What about just a plain telehealth thing with a phone call? How does that work? Is that
a telemedicine visit is synchronous audio-visual communication, and that is billed at with parity with the usual face-to-face E&M codes. Certainly, there are going to be patients that you're just going to use the telephone, and that's at a different level, and that's requires a different code. If you want to use what they call synchronous communication, that's real time communicating with the patient, you can bill as the same as face-to-face visit. So certainly there are going to be seniors that aren't going to have the technology available. That's one of the barriers. But I'm amazed when I look this up, how many seniors have cell phones, how many seniors now have access, even even patients who are in assisted living, they can go to a room that has a computer, these assisted living facilities, and they can log on in that fashion. And if you're in an assisted living facility, you can ask one of the caretakers in the facility to help, because you're going to give them step by step what they need to do, what the login is, just like I logged into this program. I logged in, I gave the meeting number, and I'm launched. The same thing happens, with telemedicine. And in the future communication grand rounds, I want to do a program on how to select a vendor. Okay, David?
All right, great. Thanks again for your time, Neil. I appreciate it, and have a good day.
Thank you, David.
Thanks. Bye-bye.